In the past, the only medical contact a patient may have had was with a general practitioner and members of family or community who had a role in nursing care and assisted the patient back to good health. However, as technologies have changed and huge amount of new information come from medical research, interdisciplinary healthcare teams are now considered essential to best deliver quality health care. Additionally, effective care are required to assist the many patients who require multiple healthcare professionals due to the amount of specialization within modern healthcare. The original role of family and professional caregivers hasn't changed, though with principle of holistic healthcare, embracing the importance of patient-centered healthcare, which includes informing and involving the patient, him or herself, as well as people close to the patient in the healthcare process. Defining a healthcare group involving holistic healthcare principle and the importance of high-performing healthcare teams in providing a patient-centered, coordinated and effective healthcare delivery system. Hollenbeek and colleagues 2012 describes three dimensions in characterizing teams: skill differences, authority differences, and stabilities over time. Healthcare groups may be extremely diverse in skill sets and discipline knowledge and may contain members from different functional and clinical backgrounds. These make effective communication and teamwork processes essential in coordinating complex healthcare tasks, which requires specialist skill and medical knowledge. Secondly, authority differentiation refer to differences in established to within a group that have highly hierarchical structure may have senior staff in leadership roles, with decision-making coming from an authority figures and lacking group consensus. On the other hand, unidisciplinary groups often have lower authority differentiation because of the more equal status among group members. Thirdly, Hollenbeek et al. Describe temporal stability as a feature of healthcare teams. Some groups may remain stable over years, whilst other groups may be formed for short-term reasons such as performing a new surgical techniques. Teams with higher level of temporal stability have greater opportunity to develop effective team process as they are more familiar with each other and have greater opportunity to plan and reflect on team input, process and output relevant to specific healthcare setting. Mitchell et al. 2012 defined team-based healthcare as team-based healthcare is the provision of health service to individual, family, and or their communities by at least two health providers who work collaboratively with patients and their caregivers to the extent preferred by each patient to accomplish care goals within and across setting to achieve coordinate high-quality care. Healthcare team, as mentioned, may have extremely diverse in their skill sets and personnel. Tuckman described 5 stages in a group's life cycle which apply to healthcare team. These include forming, storming, mourning, norming, performing, and adjourning. These stages relate to the group's formation, identification of issues, formation of rules, and methods of achieve goals. 3 examples will illustrate different healthcare teams. Team A, setting geriatric ward is with chronically ill older adult. Healthcare team, registered nurse, physicians, social workers, physical therapists, pharmacists, primary care provider, home care workers, general nurse, assistant nurse, and respite workers. Team B, setting oncology ward, healthcare team, medical oncologist, radiation oncologist, surgical oncologist, hematologist, oncologist nurses, clinical nurses, chemotherapist nurses, palliative care nurses, social workers, dietitian, support service personnel, staff, pharmacists, and education support program worker. Team C, setting small primary healthcare clinic. Healthcare team, general practitioner, registered nurse, assistant nurse, pathologist, phlebotomist, allied pharmacist. Principle of team-based healthcare have been described in the literature as involving shared goals, having clear role, involving mutual trust among members, using effective communication techniques, and having measurable processes and outcomes. Healthcare teams are unique in having their own purpose, site setting, and so on. But these principles are shared by all healthcare teams, and team effectiveness is largely determined by how well these principles are adhered to. In the following section, I'll discuss how this principle can be used as strategies and enable group functioning. Issue associated with poor group functioning will be raised as example of failure to follow this principle. Share goals among team members is essential in providing successful and effective health care. The patient, caregivers, and family must be considered as team members and health. Professionals must involve the patient in goal setting, expectation, and knowledge of available services in order to deliver patient-centered care. Full engagement in goal sharing leads to the client taking ownership of the care plan and thus a greater sense of ownership of healthcare processes. Likewise, collaborating and sharing goals within a healthcare team lead to greater commitment to effective practice, giving the greatest degree of ownership amongst health professionals. Enabling the development of shared goals include providing comprehensive information sharing amongst team members, facilitating and maintenance of accessible written care plan, and support giving to the team's capacity and monitoring processes toward the clients and team goals shared. Failure to share goals may lead to uncertainty and poor decision making, less streamlined patient care, such as with unnecessary doubling up the procedure and less cost-effective health care. In conclusion, health professionals must work effectively in team to promote the highest quality of care for our patients and communities. Interdisciplinary teams are diverse but have general features such as authority and skill differences and changing membership with time. Identify principles of effective teams include shared goals, having clear roles and mutual trust among members, using effective communication techniques, and having definable processes and outcomes. By following these principles and understanding group dynamics, healthcare professionals can be effective in delivering high-quality, client-centered healthcare. Thank you.